a little review here. Skin is composed of epidermis, that thin outer layer with that waterproof protein called keratin. And underneath that is a thick layer of dermis, the inner layer. And there are hair follicles, sweat glands, oil ducts that are in the dermis. Those are portals of entry for microbes to penetrate deep down into the tissue. Because if it were just left up to the outer layer, you'd be okay. But wherever that skin gets punctured by a hair or a duct, that's an area where bacteria can get in. So your skin has a high salt content and very little moisture. So the normal microbiota that grows on your skin has to be able to tolerate the salt and has to be resistant to drying out. There's just a picture of your dermis and your epidermis. You see that hair shafts go through there, and so there's a little opening that pathogens can get into. Skin's normal microbiota are large numbers of gram-positive bacteria, and they're resistant to drying out in high salt concentrations. Two of them that you know that we work with are Staphylococcus and Micrococcus. There's also these, and I'm just giving you a couple of examples here. Also some rods, Propionibacterium acnes, and Corynebacterium cirrhosis. Those are also skin bacteria. Propionibacteria acnes is the one that does cause acne. It is a normal skin microbiota, but it can infect the hair follicles, and then you can get an inflammatory response, and that's going to cause pimples. Just treated with topical antibiotics, unless you have, some people get what's called cystic acne, and they have to take medication. For microbes that cause rashes and lesions on the skin, we have a way of categorizing them, and I think they have them. They don't have pictures like they did in the other book, but I have some pictures. But they talk about them on page 581 of your book. So vesicles. So if you went to the doctor and you had a rash, they're going to look to see what kind of rash you have and put all that data in their history. So vesicles are small fluid-filled lesions. Bula are vesicles, so they have fluid in them, but they're larger than 1 centimeter in diameter, so somewhere in the range of ½ an inch. Macules are flat, reddened lesions, and papules are raised lesions, and pustules are papules that have pus in them. So we'll look at a couple of those. So these are vesicles. Vesicles are the small fluid-filled lesions. You had chicken pox, those are vesicles, fluid in them. These are bula. They're bigger than the vesicles. See, those vesicles are fairly small. These are large, and they're fluid-filled. Macules, those are the flat reddened lesions. And these are papules, those are raised lesions. You can see on there. And then pustules. We have pus on them. Bacterial diseases of the skin include staphylococcal and streptococcal and pseudomonas infections. Most of those are opportunistic pathogens, as we know. Staphylococcus and streptococcus are normal microbiota. And so they would need to enter the skin through cuts or burns or surgical incision, some way that they get through the skin. Staph infections are very difficult to treat. They secrete proteins that can block chemotaxis of neutrophils or even kill them. So when you have an infection, usually then something's going on that all the immune cells that are going to the infection site get called there. They know about it, but this Staphylococcus has proteins that block that process. Staphylococcus can invade the adaptive immune system. That is your one that you get. That system is the one you have after you're born and you get exposed to things. There are antibiotic-resistant strains, and those are very difficult to treat. I'm sure we all know people that have been in the hospital that acquired a staph infection while they were in the hospital. Methicillin-resistant Staphylococcus aureus, MRSA, is the leading cause of nosocomial infections in the U.S. Nosocomial meaning that they were acquired in some sort of healthcare facility. Staphylococcus can be divided into whether they are coagulase positive and coagulase negative. For some reason, we don't run this test, in the lab. But this is one way, the lab would they could run the coagulase test. So coagulase positive produces the enzyme coagulase, and that causes clotting of the fibrin that is in the blood. And these clots then protect the bacteria. The bacteria will be in these clots, and it protects the bacteria from phagocytosis by your immune cells. Staphylococcus aureus is the most pathogenic of the Staphylococci. There's more Staphylococcus than just aureus. Coagulase negative produce biofilms, and then the biofilms protect the bacteria from drying out and from any disinfectants or chemicals that you're trying to get rid of the bacteria with. And these biofilms are on surfaces. They adhere to things such as catheters. Staphylococcus epidermidis is a normal microbiota of the skin, but it's pathogenic when it breaks out through that skin barrier. And one way that can happen is on a catheter getting inserted or removed. And then these bacteria just form a film on that catheter. So this is the coagulase test. So if it's coagulase negative, you can see up on the top, nothing's happening. The coagulase positive ones, one is a total clot that doesn't move at all, and the other one has clots in the plasma. And here they're talking about some of the virulence factors, such as exoenzymes and exotoxins that the Staphylococcus produces. Staphylococcus aureus is a normal microbiota of your skin. You find it in your nose, your throat. You know it's gram-positive. You don't have to write that down, just putting it in there. It's a bacteria that can cause folliculitis, which is infection of the hair follicle. It can cause pimples, styes, boils, what they call a furuncle. It's a medical term for them. So a boil is a type of abscess, and antibiotics don't penetrate the abscess very well. So first, they need to drain the pus out of the boil. Did I ever tell you my story of my boil under my arm? When I was maybe 12, I was with my friend's family, and we were camping or in a cabin or something. And we were went out into the stream to shave under our arms. Well, I must have nicked myself or something, and after I got back, I started developing this thing until, and my mother didn't even notice it. I was walking around with my arm like this, it was the size of a walnut. But before the doctor, when I went to the doctor, he lanced it, only in those days, it was like, looked like a little fingernail scissors that he stuck in, and then he opened it up, that's how he lanced it, and stuck a tube in it to drain it, but, you can't, you need to lance it before, and get the pus out before you start, giving antibiotics, because antibiotics won't go in there. It walls it out, that boil walls off, the infection. So if your body though doesn't wall off that boil, it can invade, surrounding tissue, and then it becomes, what's called a carbuncle. And then at this point, you know, you get, fever and symptoms of, just generalized symptoms of disease where you don't feel good. Like that. Here is a boil or bronchal caused by Staphylococcus aureus from an infected hair follicle. And this is a carbuncle. You can see it's not well, this one is like well, you know, in a certain pattern there all together, where this other one is diffused just throughout the tissue. It's all inflamed and swollen. Staphylococcus aureus also is one of the main bacteria that causes impetigo. And this is where usually children that are young, like less than 5 years old, come down with this. And they get vesicles on their skin, usually their face, that rupture, and then once they rupture, then they get this crust that forms. So Streptococcus pyogenes, which is a bacteria that causes a lot of different diseases, is also one that can cause impetigo. There's a picture of a child that has impetigo, and you can see the vesicles have ruptured and the crust had formed. Also another person, like an older person, toxic shock syndrome. Something is caused by Staphylococcus aureus. It can be life-threatening, fever, vomiting, the sunburn like rash, and that can be followed by shock and organ failure. It's where absorbent packing is left in too long. Originally, we saw it when they first started coming out with, years ago, these absorbent tampons, but you also see it in nasal surgery. My son had, his turbinates taken out of his nose. And when they pack the nose with gauze, and then they take that out, that is a lot of gauze that's coming out of it. And surgical incisions and childbirth is also where you can get infections with staph that causes this toxic shock syndrome. Streptococcal skin infections. You had Streptococcus at the beginning to show us a chain of cocci, gram-positive. It secretes toxins and enzymes, and those vary with the different species of Streptococcus. It can produce hemolysins. Those are toxins that lyse, especially red blood cells, but it can lyse other types of cells. And Streptococcus pyogenes is one bacteria that is a beta hemolytic on blood cells. So hemolysin is what's responsible for that. Streptococci, not all of them are beta hemolytic. Streptococcus pyogenes is. Some of them are alpha hemolytic. And gamma hemolytic means really that there is no hemolysis.